Normally, I would think the biology lesson would be from the health department, but I appreciate you, honorary NOHD member Ramsey Green. Thanks, everyone. The New Orleans Health Department continues to work to protect the health of all those remaining in and returning to our city. This work began, of course, long before the storm struck, and is not going to stop until the need is abated. I'm pleased to say that all local hospitals are up and running on Entergy power, so thanks for that prioritization. They're continuing normal operations and dealing with expected post-storm visits and needs, but they are challenged somewhat with safe places for discharging some patients, given the lack of other infrastructure. So they do remain very full. Again, please, if you have an emergency, avail yourself of 911, use our hospitals, but if you don't, now's not the time to go to the hospital unless you absolutely need it. Pharmacies, urgent cares, and other healthcare centers are also reopening slowly, so be in touch with your provider, with your pharmacy. It's likely that they very well may be open with perhaps reduced hours. The Medical Special Needs Shelter at Morial Convention Center has been operational since Saturday and has approximately 45 patients, with hospital transfers increasing as the day goes on. We are really grateful for the tremendous partnership between federal, state, and local partners. We're continuing to ask for additional beds and resources because we don't expect the need to abate anytime soon. Our Special Needs Registry call center continues to operate to connect residents in need to the available resources as they come online. So immediately after the storm, we began our typical outreach to leadership at facilities around the city that we knew housed many elderly, vulnerable, disabled residents to assess their immediate needs and send available resources. In the first days, what we got back from them was mainly for food, water, ice, generator services, and so we worked with city and nonprofit partners to accommodate those. As the power outages dragged on and the concern for heat-related illness, particularly to the elderly, grew, we realized that we needed direct verification of what was being reported to us. And so our team at the health department, with public safety partners, decided to send out some strike teams to several of the buildings that we were most concerned about. Upon arrival to these buildings, we located, sometimes with great difficulty, someone who had master keys to all the rooms and went door to door with fire, police, and EMS so we could directly lay eyes on every individual present. In some of these facilities, we found fairly stark conditions: no power, no elevators, no lights, individuals in their rooms who couldn't access normal supports or services. Tragically, in some places, our staff discovered residents who had died and had not yet been discovered. Clearly, for several of these facilities, this indicated that there were emergent threats to life and safety for the people who were remaining there. So we quickly mobilized, getting those individuals to state shelters as soon as possible. In 3 days, today's the 4th day, our teams have visited nearly 30 facilities for comprehensive evaluations, and we've done quick assessments of several more. Close to 600 residents of these buildings were safely routed through the convention center and directly, in some cases, to state shelters where they are now secure and comfortable. And Colin mentioned the Family Connect, the Connect phone number from DCFS. If you have a relative who was in one of these facilities, I can say a family friend actually had a relative in one of these facilities, didn't know where they were, called yesterday, got a call back from their loved one who was in Shreveport just a few hours later. So it does work, and I do encourage folks to use it. We continue to return for sites visits at facilities that are on our radar for not being back up with power, or that we continue to want to make sure we're checking up on. And we deploy to others that come on our radar as soon as we hear about them, as the mayor and the council members can attest. Loss of life in a disaster is a terrible tragedy, and we mourn every one from the last few days. Our team is committed to working with the administration and others to develop better policy that prioritizes the health and safety of our most vulnerable residents through their time of need and provides better safeguards for their well-being. Collectively, all of us, we can and must do much better to help them. And it is critical to the overall health and quality of life of our city that we treat our elders and our most vulnerable with the highest levels of dignity. if you'll indulge me, a New Testament quote from Matthew 25, "Whatsoever you do to the least of my brothers and sisters, that you do unto me." Thank you.